हेलो फ्रेंड्स वेलकम टू माय चैनल। तो आज आपणकर क्लास रोची प्रेगनेंसी रो बैच 3 रे एटा आपण ऑलरेडी शेयर करा जाय छै आपणकर आ जो माने प्रिपरेशन करिया को चाहउचंती बैच रे आपण माने जॉइन करि परिबे नर्सिंग स्टाफ नर्स सॉरी नर्सिंग एएनएम आपणकर फार्मासिस्ट एलटी पिला पई कि तो से एई नंबर आपण माने मेसेज करिकि बैच जॉइन करि परिबे 6372270928। चलो हम क्वेश्चन आंसर डिस्कशन करिबा आपणकर प्रेगनेंसी टॉपिक रू। क्वेश्चन नंबर 1, what is the primary function of the placenta during the pregnancy? Option A, to produce the hormones. Option B, to provide oxygen and nutrients to the fetus. Option C, to remove the waste product from the fetus. Option D, all of the above. The correct answer is option number D, all of the above. Explanation देखंतु, the placenta plays a crucial role in providing the oxygen and nutrients to the fetus, removing the waste product and producing the hormones essential for the fetal development, जोटा कि आरो explanation रहउची। जहाँ भी आपनकर डिस्कशन होउची प्लू क्लास भी होउची ताको आपण नोट करंतु आ निश्चिंत बारंबार जते आपण माने लेखिबे आपण मन रहइबो। ଯେତେବେଳେ ବି ଆପଣ ଯାହା ବି ଭିଡ଼ିଓ ଦେଖୁଛନ୍ତି ତାକୁ ଆପଣମାନେ ନିଜ ପାଖରେ ନୋଟବୁକ୍ ରଖନ୍ତୁ ଆଉ ସବୁବେଳେ ଆପଣ ତ ଲେଖିବାକୁ ଚେଷ୍ଟା କରନ୍ତୁ। କ୍ୱେଶ୍ଚିନ୍ ନମ୍ବର 2, which hormone is primarily responsible for the maintaining pregnancy? ଏଠି ପଚାରିଛି କୋଉ ହରମୋନଟା ପ୍ରାଇମରଲି ରେସ୍ପନ୍ସିବଲ୍ ଫର ମେଣ୍ଟେନିଂ ପ୍ରେଗନେନ୍ସି ପାଇଁ କି ଇଷ୍ଟ୍ରୋଜେନ୍, ପ୍ରୋଜେଷ୍ଟେରନ୍, ହ୍ୟୁମାନ କ୍ରୋନିକ୍ ଗୋନାଡୋଟ୍ରୋଫିନ୍, एससीजी फोलिकल स्टिमुलेटिंग हार्मोन। तो करेक्ट आंसर इज ऑप्शन नंबर बी प्रोजेस्टेरॉन। ऑप्शन नंबर बी आपन करेक्ट आंसर रहिबो प्रोजेस्टेरॉन, जोटा कि मेंटेन करता है प्रेगनेंसी। तो एक्सप्लेनेशन द प्रोजेस्टेरॉन हेल्प्स द मेंटेन द प्रेगनेंसी बाय थिकनिंग द यूट्राइन लाइनिंग एंड सपोर्टिंग द एम्ब्रियोनिक डेवलपमेंट, जोटा कि आर एक्सप्लेनेशन रहउची। क्वेश्चन नंबर 3, व्हाट इज द टर्म फॉर द पीरियड ऑफ प्रेगनेंसी व्हेन द fetus is most vulnerable to the tetragens genes? तो करेक्ट आंसर आपण मानक हे जिवो ऑप्शन नंबर ए एम्ब्रियोनिक पीरियड, जोटा कि ऑप्शन नंबर ए हे जिवो आपनकर करेक्ट आंसर। एक्सप्लेनेशन देखंतु, the embryonic period weeks 3 to 8 is a critical time for the fetal development, and exposure to tetragens during this period can lead to the birth defects. Question number 4, which of the following is a common symptom of pregnancy? Nausea and vomiting, fatigue, breast tenderness. The correct answer is all of the above आपनकर symptoms रहे प्रेगनेंसी रो। तो एक्सप्लेनेशन देखंतु आपनकर nausea and vomiting, fatigue and breast tenderness are common symptoms experienced by the many women during the pregnancy. Question number 5, what is the purpose of prenatal care during the pregnancy? To option A, to monitor the fetal development. Option B, to detect the potential complication. Option C, to provide the education and support. Option D होची all of the above. The correct answer is आपनको all of the above. एक्सप्लेनेशन देखंतु ये जो आपनकर ऑप्शन ऑल ऑफ द एबव आसुची सब कुछ क्वेश्चन ए भले आपनकर आसीबो एग्जाम पॉइंट ऑफ व्यू आपण मन पे ए सब क्वेश्चन आगुरा आपण मन जानिथिबे तार सिम्पटम्स कोन तार सब विषय डिटेल्स जानिथिले आपको आंसर दे परिबे। प्रीनेटल केयर इज द एसेंशियल फॉर द मॉनिटरिंग fetal development, detecting potential complication and providing education and support to the pregnant women. What is the average length of full term pregnancy? एटी पचाची average length full term pregnancy एभली क्वेश्चन आपण ऑलरेडी ग्रुप रे डिस्कशन हेची 36 weeks, 38 weeks, 40 weeks, 42 weeks। तो करेक्ट आंसर हे जो आपण मानकर ऑप्शन नंबर सी 40 weeks। A full term pregnancy typically lasts around the 40 weeks from the first day of the woman's last menstruational period, जोटा कि आपनकर रहउची। एक्सप्लेनेशन क्वेश्चन नंबर 2, which of the following is sign of preeclampsia? जोटा कि हाई ऑप्शन ए रहउची हाई ब्लड प्रेशर, ऑप्शन बी होची प्रोटीनोरिया, ऑप्शन सी होची सेवियर हेडेक, ऑप्शन डी होची ऑल ऑफ द एबव। ऑल ऑफ द एबव आपनकर करेक्ट आंसर रही सिम्पटम्स जोटा रहउची। Preeclampsia is characterized by the high blood pressure, proteinuria, and excess protein in the urine, and symptoms like severe headache. What is the purpose of non-stress test during the pregnancy? कौन purpose होची non-stress test रो? To monitor the fetal heart rate, to assess the fetal movement, to detect the fetal distress. Option D all of the above. The correct answer is अपना option number D। D है जो अपना ऑप्शन करेक्ट आंसर। The non-stress test monitors the fetal heart rate and movement up to assess the fetal well-being. Which nutrient is crucial for the preventing neural tube defects in the fetus? Folic acid, iron, calcium, vitamin D. এটা भी आपन important question. तो correct answer is option number A. आपन folic acid. Explanation देखंतु folic acid supplementation before and during the early pregnancy helps prevent the neural tube defects. जोटा कि explanation रहुची. What is the term for a condition where the placenta separate from the uterus before the delivery? तो करेक्ट आंसर हो आपनकर ऑप्शन ऑफ बी प्लासेंटल अब्रप्शन जोटा कि आपनकर ऑप्शन नंबर बी हो करेक्ट आंसर placenta abruption occurs when the placenta separates from the uterus depriving the fetus oxygen and nutrients. What is the gestational diabetes? A type of diabetes that developed during the pregnancy, a type of diabetes that exists before the pregnancy, a condition that causes high blood pressure during the pregnancy, a condition that causes proteinuria during the pregnancy. The correct answer is option number A type of diabetes that exists before pregnancy. Sorry, a type of diabetes that develop during pregnancy. Sorry, এটা option B କହିଥିଲି ଆପଣଙ୍କର option A ଆପଣଙ୍କର right answer ହବ type of diabetes that develop during pregnancy. ଯାହାକୁ ଆପଣଙ୍କର କ'ଣ କୁହାଯାଏ? gestational diabetes. ଦେଖନ୍ତୁ explanation ଦେଖିଦିଅନ୍ତୁ. Gestational diabetes is type of diabetes that develops during the pregnancy, usually in the second or third trimester. ଆପଣଙ୍କର କହିଥିଲେ. Question number 2. Which of the following is a risk factor for the ectopic pregnancy? Risk factor ରହୁଛି କ'ଣ? यार previous pelvic surgery, option B history of pelvic inflammatory disease, option C रहुछि आपनक use of assisted reproductive technology, option D all of the above. तो correct answer is option number D all of the above. Explanation देखंतु risk factor of the ectopic pregnancy include previous pelvic surgery, history of pelvic inflammatory disease and use of assisted reproductive technology. What is the purpose of biophysical profile during the pregnancy? कौन biophysical purpose रहुछि profile रो BPP जोटा कहंती the monitor the fetal heart rate to assess the fetal movement and tone to evaluate the amniotic fluid levels, option D all of the above. तो correct answer is आपनकर option number D all of the above. A biophysical profile assesses fetal well-being by the monitoring the fetal heart rate, movement, tone and amniotic fluid levels. Which of the following is common cause of the pregnancy related hypertension? It is common cause of pregnancy related hypertension, preeclampsia, gestational diabetes, placenta previa na fetal growth restriction. The correct answer is option number A preeclampsia जोटा कि correct option A होगा अपना correct answer. Explanation देखंतु preeclampsia is the common cause of pregnancy related to hypertension characterized by the high blood pressure and proteinuria. What is the term for a condition where the baby's feet of buttock are positioned to be born fast? Breech presentation, cephalic presentation, transverse presentation, vertex presentation. The correct answer is option number A, breech presentation. ये सब क्वेश्चन आपण मान पे इंपोर्टेंट आपण नोट करेंगे यार ऑलरेडी आप पीडीएफ बैच रे दिया जाइए जो मैंने बैच जॉइन करेंगे फुल पीडीएफ आपको मिल जाए. एक्सप्लेनेशन देखो तो ब्रीच प्रेजेंटेशन occurs when the baby's feet or buttocks are positioned to be born fast rather than the head. What is the primary cause of morning sickness during the pregnancy? Hormonal changes, stress and anxiety, poor diet, dehydration. The correct answer is option number hormonal changes. Morning sickness is primarily caused by the hormonal changes, particularly the increase in human chronic gonadotropin and estrogen level. Which of the following is the benefit of breastfeeding for the mother? Reduce the risk of breast cancer, faster uterine evolution, increase the weight loss, all of the above. तो ब्रेस्ट फीडिंग आपण बेनिफिट कौन रोचे? ऑल ऑफ द एबव आपण करेक्ट आंसर हम रिड्यूस रिस्क ऑफ ब्रेस्ट कैंसर, फास्टर यूट्राइन इवोल्यूशन, इंक्रीज द वेट लॉस. Breastfeeding has several benefits for the mother, including the reduced risk of breast cancer, faster uterine evolution, and increase the weight loss. What is the term for a pregnancy complication characterized by the high blood pressure and damage to the organs such as kidney and liver. तो करेक्ट आंसर है आपनकर ऑप्शन ए प्री क्लाम्सिया जोटा ऑप्शन ए आपनकर करेक्ट आंसर रहइबो. Preeclampsia is the pregnancy complication characterized by the high blood pressure and damage to organs such as kidney and liver. Which of the following is a sign of preterm labor? Contraction every 10 minutes or more frequently. Option B, leaking of fluid from the vagina. Option C, pelvic pressure or discomfort. Option D, all of the above. The correct answer is option number D, all of the above. Explanation देखो preterm labor is characterized by the contraction, leaking of fluid, pelvic pressure and other symptoms that occur before 37 weeks of gestation. What is the purpose of fetal ultrasound during the pregnancy? Option A, to monitor the fetal growth and development. Option B, to detect the potential fetal anomalies. Option C, to determine the fetal position and presentation. Option D, all of the above. The correct answer is option number D, आपनकर all of the above correct answer ରହିବ. Explanation देखो आपण कौन रोचे. Fetal ultrasound is used to monitor the fetal growth and development, detect the potential anomalies and determine the fetal position and presentation. What is the term for a pregnancy that develops outside the uterus? आर करेक्ट आंसर है ectopic pregnancy जोटा कि ऑलरेडी अपन डिस्कशन है. Ectopic pregnancy occurs when a fertilized egg implants outside the uterus, often the fallopian tube.